He was a trucker and overweight like a lot of these guys and gals who dragged freight across the country, and his wife came with him to make sure that he told everything. He described struggling to stay awake while driving that had been going on for years. But as he's gained weight and grown older, the problem's been getting worse. Then she added, he snores loudly, and recently she's heard spells of not breathing followed by a snort, coughing, and up to the bathroom. This informed wife said to me, "Do you think he could have sleep apnea?" She was right. The diagnosis was confirmed by a sleep study, and I think treatment saved his life. His was the classic case, which includes a wife who worries about her husband snorting during sleep. Sometimes patients with this condition don't come in with such a perfect picture, however. They might have only a morning headache, an irregular heart rhythm, worsening leg swelling, and increasing nighttime urinary frequency, anger and memory issues, or even just a dry mouth. Or worse, it may be severe hypertension, or a new heart attack or stroke, or a sleep-induced motor vehicle accident. Although sleep apnea is more common in men, smokers, the obese, and the elderly, it can also occur in women, non-smokers, thin people, and youth, even children. It runs in families with inherited anatomy like short necks, recessed jaws, small nasal passages, and is made worse in those who take tranquilizers or sedatives or alcohol before bed. Experts now estimate that at least 12 to 18 million Americans have moderate to severe sleep apnea. That's about 5% of the population, and likely that number is higher since this condition too often goes undiagnosed. In a 14-year Australian study of 30 to 65-year-olds, about 7% of the people without apnea died over that period of time, while 33% of those with moderate to severe sleep apnea died, almost a 5-fold difference. A similar increase in death rate with sleep apnea was found in Wisconsin study. Here's the good news. There is reduction in death rate with treatment. Do you think you could have sleep apnea? Don't wait for your wife to get you to the doctor. Ask about having a sleep study. It could save your life.